Welcome to Navix Chat. I'm Kristen Smith, VP of Marketing for Navix Health. And today I have Jason Brumbach, who is the founder of Navix Health, and Colin Christie, CTO, Chief Technology Officer of Navix Health. And we're going to be talking about AI in the behavioral health industry, where it's headed, what we are doing at Navix Health, and where the future is. So let's start. What, first of all, is the buzz with all this AI?
So, it's interesting, Kristen. AI seems like it sort of came out of nowhere this year because ChatGPT, I think probably most of our audience are already familiar with that. But actually, it's been a multi-decade journey. So probably the real sort of foundation was back in the Cold War days in the 1950s. In fact, the term artificial intelligence was first coined by John McCarthy, a professor at Dartmouth College. And there was this big buzz and excitement, almost like we have today during that decade or so, because everyone thought, oh, this was going to take over, computers are going to be able to think and do, and all of this sort of thing. And of course, it didn't. And funny enough, during the 80s and 90s, they call it the AI winter, because if you were an academic in any university, the death knell to getting any funding was to say that you were working on artificial intelligence. It was like, oh, no. It was like talking about UFOs or something. So then that's why over the last years, it has been a little bit of a after effect of that, of not wanting to overhype AI. So it's crept into our lives over the last, let's say, decade without us even realizing it. So for example, when you use Uber, that's AI. Or if you're using Google Maps and it's telling you it's going to take you 37 minutes to get from point A to point B, that's AI. If you go on Google and you search for cats, those images are coming up through something called a convolutional neural network. AI is what's doing that. So we call this the AI resurgence. And so if it's been around for so long, then why all of a sudden are we talking about it? It's something which maybe we can go into in a minute. It's something called generative AI. It's like a new breed of AI that's different from this AI that we've been using over the last 10 years.
Okay, and can you explain to me what is generative AI? I've heard this term.
Yeah, so the idea is all of those previous AIs are taking what we call training data. They've been trained to recognize a cat or to figure out the distance and to understand the traffic patterns on Google Maps or something like this. And another example I think everyone is familiar with is on Spotify or on YouTube or on Netflix. It's how it recommends. So we have these like recommender AIs, we have these different systems, but it's not creating anything new. It's just taking information and helping you with that information. Generative, as the word implies, and we've mentioned ChatGPT. I think a lot of people know ChatGPT. ChatGPT, by the way, never ask, you're in marketing, never ask engineers to name your product. I think OpenAI made a big mistake. What does GPT stand for? Listen to this: Generative Pre-trained Transformer. Oh, that explains to me what it does. So generative is the G in GPT. It just simply means that the AI now has the ability to create new information. So you can prompt it, and then it can generate new information.
Okay, perfect. And Jason, now I know November was a big turning point for you. What happened in November of last year?
Yeah, thank you. So in November, ChatGPT 3.0 launched, the first consumer large language model where we could interact as consumers. And I remember when it was released and I didn't know what it was, but Colin called me and said, hey, we need to talk about AI and how it's going to impact every industry known to man. And it didn't click for me until probably January, when I started to understand the impact and the power of what happens and how this applies to behavioral health, right? Because we're building a behavioral health platform. So I was trying to figure out, how is this going to impact my customer? How is this going to help their ROI? How is this going to impact patient care? And it took me a month or two to start seeing the light, how it's going to transform all of technology, and especially what it's going to transform for behavioral health.
Yes, exactly. Now, why would we not use ChatGPT for business? Why do we need to create our own? What's going on with that?
Sure, I can address that. So the first thing to understand is ChatGPT isn't actually the AI, the brain, let's call it, to make it sort of relatable to our own brain. ChatGPT is actually an application that's built on top of the AI. And actually, OpenAI, this is the company that introduced ChatGPT, wasn't even planning, ironically enough, to build this app. They built the brain, and they just thought naturally some Silicon Valley startup would get this idea of creating an app like ChatGPT. And then month after month went by and it wasn't happening. And they really will make their money by working with development companies, not necessarily direct to consumer. And it wasn't happening. So then they just did it themselves. And so ChatGPT has some issues. It's great for general home use and even certain types of business use. But let's talk specifically healthcare. There's some issues with using something like ChatGPT for healthcare. For example, I'm sure people have heard that it hallucinates, it makes things up. This is probably an alarm bell going off already. Anyone who's in our space, like, oh, okay, that's nice. I ask it a question, it hallucinates the answer, and now I'm putting this in my medical record. No, thank you. So there are some technical reasons why that happens, but what's happened is, and that's a bit unfortunate, because then people think that the experience in ChatGPT is representative of what what I'm calling the AI brain underneath is doing. And that's actually not true. So it turns out, another reason why this just popped up in the last, few months is that the capability of that AI brain has been exponentially improving. And in fact, in the next 1 year, 2 years, 3 years, my minds are going to be blown as it continues to evolve. And Jason mentioned it was version 3.0, ChatGPT 3.0, that came out in December. ChatGPT, if we compare it to a human brain, without getting into our high school biology, we all have this awareness that we have these things called neurons in our brains, and we have trillions and trillions of these things. And that's how our brain works. Well, what the computer scientists have figured out how to do is build a digital equivalent of neurons. That's why it's called a neural network. And ChatGPT 1, which was 3 or 4 years back, and 2, which was a couple of years back, had very small number of these neurons. So think of it like maybe like a mouse brain or something like that, a rabbit brain or something like that. It's not going to be particularly intelligent. ChatGPT became possible in this past few months because they now got into the trillions of neurons in these digital neural networks. But returning back to your question, the reason why you wouldn't use it, for example, in healthcare application, number one, is it hallucinates. And then number two is it isn't particularly focused on our area of specialization, our behavioral health specialization. Yeah, it's great at helping you with an apple pie recipe or how to create an organic garden. And I don't want to imply that it's not good at certain types of business applications, like marketing, for example. If you need to write a blog, if you need to have it generate some text for a Facebook post or something like that, brilliant. It's brilliant. But the medical domain and being accurate and focused, concise around generating medical information that's going to be useful in a medical setting, no, it's not appropriate.
Okay.
Colin, I got a question on that. And is it HIPAA compliant if someone's using ChatGPT?
Great point. No, it is not. Okay. So actually, this is probably another alarm bell that we should sound for people. Probably the two being hallucination, and number one, and then number two, not HIPAA compliant. So if you are already out there listening to us and you've already been tempted to sort of clean up your medical notes, especially if you have PHI in there, stop, because it's not HIPAA compliant.
That's a perfect segue into my next question. So tell me how Navix AI comes in and fills this gap.
Yeah. So Navix AI it's built around documentation tools currently that specializes in healthcare and behavioral healthcare right now, particularly. And it is HIPAA compliant. So it's all end-to-end encrypted. We've been building the infrastructure on Navix Health since last year. And the infrastructure is probably the hardest part to build for AI, and how you're going to use all that file and the documentation and all the vector files, and how you're going to extrapolate that information to the AI engine to give you an output. So currently how we're using it is really focused on documentation time, because as we know in healthcare, of a clinician's time, it's about 40% of a clinician's time is writing documentation. And we think we easily can cut that in half this month. We just released a tool this month that we think is going to cut that in half. So, and that's called Navix Scribe, which listens to your therapy session and automatically writes the note. So those are some of the tools. We have a lot more tools. So yeah.
That's great. You guys have mentioned the power of the LLM, the large language model. Is there anything else to say about that, or kind of have we hit on that? I'm curious about that.
Yeah, Kristen, I'm glad you mentioned that. So I've been referring sort of generically to the application, ChatGPT, but then this quote unquote brain. But to be more precise, this brain, what they really call it is an LLM, a large language model, right? This is what has those trillions of digital sort of neurons in it. And this is the exciting part. To be honest, my own mind is, and I've been involved in this for years, but my own mind is still blown like every day in how capable it is. The way to think about the LLM is it's a reasoning engine. So what do I mean by that? Believe it or not, you can feed it information and it literally can give a reasoned, logical response the way a human can. This might be a little alarming.
This is where prompt engineering comes in.
Yes, correct.
You guys use prompt engineering,
yeah. So some of the folks out there may have heard this term prompt engineering, but it's a combination of using models that have access and have been trained or fine-tuned, another term we call fine-tuned, on medically relevant data, and then something called prompt engineering, and a lot of work that we sort of technical folks do on the back end to connect up. So we have a new tool in the toolbox, this LLM, this brilliant reasoning engine. So we're able to take, for example, Jason mentioned Navix Scribe. We can take a dictation, either real time or pre-recorded dictation. We can feed this dictation into the LLM, and we can instruct the LLM to create a SOAP note, for example. We can explain what a SOAP note is, and then think about it. If you just take a raw, sort of free-form dictation, it may not necessarily be structured. The conversation may bounce back and forth on different topics. You need to reason. What is the subjective content? What is the objective content? What is the assessment? What is the plan? The SOAP format that we're also familiar with. That's a reasoning process. Now we have a tool that can do that. So that's why we're able literally in like less than a minute, take a several minute long dictation and output an accurate SOAP note.
I love this. This makes so much sense. And I love the way that you break it down. Let's move out of the techie talk, and talk about more use cases. What does this mean as I'm a clinician? What are some of the more tactile tools that Navix AI includes that can improve my day?
Yeah, good question. So we already mentioned Navix Scribe, and I'm going to answer your question, but I'm going to also answer where this all goes, because this is just the beginning stages. So what we're going to see over applications over all spaces is tools like Navix Scribe that listens to your therapy session, or Navix Note Writer that you put your note in there and it restructures it and cleans it up and makes sure it's the correct diagnosis or suggests diagnostic codes, or Navix Chat, which sort of helps clinician insights of different interventions to help with clients or different group ideas, or you name it, anything you can ask Navix Chat, it'll sort of suggest different things for clinicians. Where this really goes, the really impactful tool that we're going to see over the next couple of years is a tool that we're going to be releasing, and I don't have a timeline on this, but hopefully within the 12 months, the V1 version, is Navix Interact. And so this is the next stage of where software applications are going. So everyone's very used to clicking through a software to get to your destination. So I have to start from the home screen and go to the clinical tab and go to group notes and go to the BPS, right? So it's this click through to get to your destination. And where AI is going to, where the true power of AI is, you'll no longer be clicking through your system. It will be an interaction with your application. And that will begin with chat. I'll be chatting with it over the keyboard. It's going to end up with communication. So Navix Interact will be a tool where a clinician, a doctor, a psychiatrist will be able to interact with their system, where they used to click through their system, but now they're interacting for what they want done. They want a clinical summary done. They want to do an e-prescribe. This is all going to be through a conversation with the AI engine, and then the AI engine is going to be doing these tasks and completing them. Where the power is going to get really cool is when the AI engine has all the history of your patient, because they have access to all the medical records, and they know from all of our engineering that Colin and his team is doing, they're knowing what's important for clinicians to provide the best care to have the best possible outcome. So now a therapist who has a caseload, who's working with 10 people fighting addiction, now it's really going to be 2 on 10 instead of 1 on 10. Because now she's going to have a smart application suggesting interventions, groups, different modalities, telling the doctor that Zoloft didn't work for them in their last treatment stay. And you can just name the examples where the AI engine is going to be interfacing with the clinician, and it's going to be their assistant. And so now technology has gone from the human brain, which is great, but it's very faulty, and we have a lot of tasks to do, from an application that's smarter for us, has more data about the patient, can comprehend more than us, and is going to be giving us insights on how to treat the patients to have better outcomes. So that's where we're really going. Where we're at today is a foundation model, because we have to meet our users where they're at, including me. But where we're going is going to be an interaction interface and an insightful interface, so we have better outcomes with our patients.
That's incredible. Thank you, Jason. Thank you, Colin, so much for just kind of breaking it down in a very palatable way and helping us understand, A, what all this AI and ChatGPT is, but also what we're doing forward thinking into the behavioral health industry. It's huge. Just appreciate you guys. And if anyone wants a demo or to meet with us, you can easily schedule that through our website or email us or send us a message. Thanks so much.
Thanks, everyone.
Thank you, Kristen. Thanks, Jason. Thanks all.
All right. Bye-bye.